Mina Aissatou Sise. As the Ministry of Health and Sanitation, they continue for the status update for the COVID-19 in the country. Sarah Network then at the National Emergency Operations Center concerning the update. We will listen to the official spokesperson for the COVID-19, Solomon Jamiru, as he give the update and respond to some questions.
Good morning, everybody. Welcome to today's press briefing for the 6th of May 2020. We have our subject matter experts here. We have Brigadier Professor Dr. Fodesa, and we also have Dr. Samuel Smith here, and we are expecting other subject matter experts to join us. We will start by asking the official spokesperson to give the status update for today.
Thank you very much, Harold, and good morning, everybody. So, status update for 6th May 2020. Total cumulative confirmed positive cases, 225. Total number of deaths, 14. Active new cases, 26. Active cases at isolation centers, 157. Cumulative recoveries, 54. Number currently in quarantine, 1,660. Number discharged from quarantine, 1,759. We want to use the opportunity to say thank you to Sierra Leoneans for the 3 days nationwide lockdown. Further to the pronouncement by His Excellency the President, the 3 days lockdown was meant to be an enhanced measure to help us fight COVID-19 within the context of the public health emergency. We wish to inform the general public that cumulative nationwide tests total about 2,447. For the 3 days lockdown, we have been able to record at about 70 cumulative positive cases and at about 27 recoveries for the 3 days. The current bed capacity at our treatment facilities, 302. And when you take the active cases, the figure which is 157, it means we could still have available 145 bed capacity. So we have for our treatment centers the 34 military hospital, Jewel, Frobe College, where Frobe College made provision for mild and asymptomatic cases. And for Frobe College, we have been able to generate not less than 150 treatment beds. We also have Lungi, we have Makeni Maburaka, we have Bon. I know that another issue that has been occupying the minds and attention of Sierra Leoneans has to do with case 90. That issue kept coming, and we are pleased to inform the general public that case 90 has been tracked down. And we say thanks to the Sierra Leone police, we say thanks to the Sierra Leone military, we say thanks to our communities and Sierra Leoneans generally for your support. So that is the update, Harold, as of now.
Thank you. We've just, Mr. Ujas, from the Director Ujas from ONS has just joined us. Now we would ask that you give your questions. You say your name and your media house. Yeah.
I am Aissatou Sise, actually from Sierra Network Press. My question is that I want to know why our media house was denying pass for the 3 days lockdown, because we applied for the pass. The first lockdown we also tried to have a pass, but we are not given any pass. And this 3 days lockdown again, we applied for the pass, but we are denied pass, and that limits our work for the 3 days lockdown, because we have a whole website on our own that we usually put on the press briefing. So people follow us online.
Okay.
Which
Sierra Network Press.
On Sierra Network Press, not granted a pass. We know that we had released policies and procedures. It is not everybody that will do coverage that will be granted a pass, and it's for very specific reasons. But we believe that we have attached primacy to media institutions and journalists largely, and I believe that passes had been given. On your own specific issue, the reason why that institution may not have been granted a pass, I cannot tell. It is something we would have to investigate and see. As long as it has justification, I am sure the institution should be willing to look at it again. So let us note that as a concern for further discussions. So there has been an issue on Tobo riot. I also got a call this morning whilst coming to the EOC, and once I got the call about giving us an indication about Tobo, it justified the public notice that we issued yesterday, because based on some indications that some persons have started targeting or attacking ambulances and healthcare professionals, our first response was to do a public notice for the attention of the general public that at this critical time in our country's history, our healthcare workers, our healthcare professionals deserve the love, the care, and the support of Sierra Leoneans generally. So we think that it will not augur well for the fight against COVID-19, where people are sacrificing their lives, their time, their energy, and then what they would have as reciprocity is to attack them at the time that we need them most.
Hello, welcome to this interview. Your name and school that you've been.
I will Thomas, Health Education Program Manager and Communication Lead at the Ministry of Health and Sanitation.
As we don't end the 3 days lockdown, I want to make it tell you if we're not able to succeed the purpose of this 3 days lockdown.
Yes, to a greater extent we're able to succeed, because for this term, USSFC, we don't get some new cases where if we not been under the lockdown, some of them cases and they will not be able for failure. Although some of them now we net within the quarantine places will be the monitor. But even some deaths and we see say them in the outside the treatment facility we will forget them and ascertain due to COVID. And what then deaths and we also the surveillance and all activate them protocols for also do further case investigation for break the chain of transmission.
And during these 3 days, I want to make it tell you, what are some of our findings?
Well, we find out say this term compared to the last term, we get less people within the streets, because we aim is we get less people within the streets so that we go able for make people in dinner house, because by when in dinner house we are able for reduce the spread of this COVID-19. And also we use these 3 days also because when they are able people and they talk about community transmission. So the hotspots area then, say western area now get the highest case load by all the districts and followed by western area rural. So western area urban, we identified 5 hotspots areas in the western area where we go talk to people and we them volunteer for let them talk to we and give we take them specimen randomly, not to all man, so that we go just pick at the community, so that now they go show we whether this thing they circulate at the community where we don't know. And by the end of these 3 days, after we don't get all the laboratory reports together, we'll be able to tell the public say, yes, we get evidence of community transmission at this area and this area when the results will don't come off. And also we'll be able to use this term because people in dinner house, then they listen to radio station, the IRN, you know, we connect over 65 radio stations them. And people them be they listen more because they not be the good no way. From the feedback we get, from the text we them be they send, from the voice call them we them be they give, it shows say plenty people them be they listen and then be they get a message and then they contribute.
And also I want to make you tell if you get any challenges.
Yes, of course we get challenges there and there. You know, some people may not be one for actually look for adhere to what will be the say. But now that make we get even security people we self we they talk to people for me then see reason why them for stay at home. And the other challenges we'll get again. Some people na some area they attack with ambulance system, and then ambulance and they for transport patients some not for COVID patients even, and we health workers and they do so well. If we're not able for tell and thank yourself, we're not for attack them. So these are some of the problems that we get. We get one or two communities back we themselves also been attack health facility and we health staff them.
So in the future, in case we get forget any other lockdown, what we have to do for making kind of challenges there as well?
Well, we don't learn from the experience, and we will use that learning experience for make sure say we improve on them. Like how we improve from the first to this second one way a lot better. We go able to use that experience and the lesson we don't identify for make we get a better in lockdown for the next if at all we get forget other lockdowns.
Okay, thank you very much.
You're welcome.